Principle of re-education. Re-education. The success of any treatment depend upon ability to gain cooperation of the patient, mental attitude and hygienic conditions. Can't be dealt by the physiotherapist. Postural defects rarely lead to structural changes. If they are prolonged, they may lead to muscle and ligament adaptive shortening, so limitation of joint movement. How to improve? These can be improved by the following ways: relaxation, mobility exercises, repeated presentation of the satisfactory posture, cheerful environment, spirit of enjoyment, and judicious praise will build up desire to achieve. Local conditions. These can be removed if they receive suitable attention. Pain is alleviated by appropriate means. Muscular weakness can be removed by the strengthening. Localized tension is removed by the relaxation. Techniques of re-education. The atmosphere and the physiotherapist can do much to gain the cooperation of the patient by his manner and approach. Individual instruction is essential, as no two patient can have identical difficulties. Sometimes group activities can also be performed. Relaxation. Relaxation is very important factor for re-education, as some degree of tension is nearly always associated with poor posture. General relaxation. Horizontal position reduce muscular tension and give feeling of alignment. Voluntary relaxation for specific group of muscle which is taught. Local and voluntary relaxation of group of muscle can be taught in lying and the erect position, first by contrast method, then by learning to recognize a state of tension and then letting go. Example of relaxation: crook lying, lying or prone lying. General relaxation. Crook lying. Relax shoulder to support surface with expiration. Forehead support. Prone lying. Head resting and lowering with relaxation. Sitting. Shoulder shrugging and retraction followed by relaxation. Crook lying and forehead. Prone lying. Mobility. Normal mobility is essential to enable a wide variety of posture to be assumed. Abnormal mobility is liability rather than asset, as additional muscle effort is required to control it, or in some cases it may be contributory to poor posture. General free exercises which are rhythmical in character and include full range movement of all the joints. Important ones. Full extension is performed because they are more liable to limitation, except in case of lumbar spine where flexion and shoulder joint, in which lateral rotation is limited. Hanging position is more useful for the children's. Muscles power. It is rarely a cause of poor posture. When joint stiffness is present, exercise for the muscle which are stretched is necessary for relaxation and to restore balance. For example, work for upper back extensors and scapular retractors is required for re-education of stooping posture. Presentation of good posture. There is no one method of teaching for the patient to assume and experience the feeling of good posture. The method and technique depend upon patient and physiotherapist. Those who have habitual poor posture feel uncomfortable and unnatural in